Welcome back to Insight. We're at Indiana Physical Therapy, and we're talking to Brittany about what sort of headaches?
Cervicogenic headaches.
I didn't want to try to say that.
What
does that mean?
So, we're all familiar with, there's many types of headaches that we can experience. We're normally all familiar with the migraines, the tension headaches, things like that. But there's a subgroup of headaches that are cervicogenic headaches. And basically, what that means, it's a secondary type headache, meaning that the head pain, the head or the face pain that you're experiencing, it's not really truly coming from the head. It's actually more coming from a source in the neck or the cervical spine.
There's the cervical spine. Okay, gotcha.
Exactly,
So,
yeah.
and then, so obviously, somebody might, take some Tylenol or whatever and try to make it go away. At what point do they come to see you?
Typically, in my experience, they don't actually truly come to me for the headache necessarily. What I see in the clinic, just because, we're not so much aware that these are necessarily related to the cervical spine. So typically, in my experience, what I'm encountering in the clinic is I'm seeing these patients, they're coming in for neck pain. They've had this neck pain for a while, it's not going away. And then as we're talking to them, back and forth, trying to kind of delve into their history a little bit more, kind of figure out exactly what's going on with them, it comes to light a little bit that they've actually been having these headaches for quite a while, that they were just completely unaware that they are related to their neck pain.
So is there a typical candidate? Who is this person that typically has that sort of problem? Are they doing the same motion over and over, or are they...
So in this day and age, kind of exaggerating, we like to do, it's a lot more computers, a lot more desk jobs, so I'm going to exaggerate that forward head posture. We get in these positions. So a lot of people that have that poor postural awareness are going to be predisposed to it a little bit. And then, lucky for us females, women are actually 3 times greater going to be experiencing these type of headaches.
So yeah, there's times when I'm writing a mad text to my kids and I've got my head down like that for a long time, then I was like, okay, that some sort of stretch or something.
Right, exactly. And then so over time, if you do that in the short term, it's not such a huge deal. But over time, that's actually going to end up loosening the deep cervical stabilizer muscles and tighten some structures in the back that are going to put an increased strain on your cervical spine that's going to create the source for that headache.
So what's treatment look like?
So treatment, there's 3 big things that we do in physical therapy for that. The biggest one is manual therapy. And what that entails is us actually physically putting our hands on you and getting in there, doing some joint mobilizations to the restricted area, that cervical segment, going in doing some soft tissue massage, loosening up any tight musculature that could be involved with it, some trigger point release, things like that. But secondly, we've definitely got to work on some of those corrections of the musculature that we talked about. So strengthening those deep cervical stabilizers, stretching out any tight musculature that could be involved in the cervical region. And then we also we talked on, so that faulty posture, we really want to get a postural awareness and correct that, so that way, you're just more aware of that, and we get in that position and you're like, hey, you can kind of check yourself and bring yourself out of that.
Yeah, that's all good stuff, and especially I would imagine, people that are at work or at home on the computer a lot need to kind of check that posture probably every couple minutes.
Right, exactly.
So if people want to see you with direct access, they can come see you first.
Correct, yes. Indiana participates in direct access, and so basically what that means, as long as you have that insurance that participates in that, you can come see us for 24 consecutive calendar days. So you can just give us a call. What we'll do is our front office will get you scheduled with an appointment for an initial evaluation with your therapist, at which point they will do a formal evaluation on you and kind of rule out any other serious causes that your headache could be from. And then at that point, they'll determine what the most appropriate
course of treatment
of treatment would be.
If you'd like to find out more, indianapt.com. We'll be right back on Insight.